Introduction. Welcome, medical students, to today's lecture on the fascinating topic of Horner's syndrome. In this extensive script, we will delve into the complexities surrounding this condition, discussing its pathophysiology, etiology, clinical manifestations, diagnostic tools, management strategies, and the challenges it presents in contemporary medicine. So, let's begin our journey into the intricate world of Horner's syndrome. To comprehend the essence of Horner's syndrome, we must first grasp the fundamentals of the sympathetic nervous system, SNS. The sympathetic nervous system, or SNS, is a division of the autonomic nervous system responsible for regulating various physiological responses during stressful situations, commonly known as the fight or flight response. The SNS controls the dilatation of the pupil, elevation of the eyelid, and constriction of blood vessels, among other vital functions. Understanding these mechanisms is crucial, as any disruption in the sympathetic pathways can lead to the development of Horner's syndrome. Horner's syndrome is characterized by a triad of symptoms, including ptosis, drooping of the upper eyelid, miosis, constriction of the pupil, and anhidrosis, lack of sweating on the affected side of the face. These symptoms occur due to the disruption of sympathetic innervation to the head and neck region. The underlying etiology of Horner's syndrome can be diverse, ranging from congenital causes to acquired pathologies. Congenital Horner's syndrome is usually present at birth and often associated with neuroblastoma, a type of childhood cancer. Acquired Horner's syndrome, on the other hand, can arise due to tumors, trauma, vascular lesions, or even iatrogenic causes, such as surgical interventions or medication side effects. Identifying Horner's syndrome relies on a meticulous clinical evaluation. Apart from the classic triad of symptoms, additional signs may aid in the diagnosis. These may include anisocoria, unequal pupil size, heterochromia, difference in iris coloration, and slight ptosis of the lower eyelid on attempted upward gaze, a phenomenon known as reverse ptosis. Moreover, a thorough medical history, including past traumas, surgical interventions, or the presence of other associated conditions, can provide valuable clues for the correct diagnosis. To confirm the presence of Horner's syndrome and determine its underlying cause, various diagnostic tests are employed. The first step is the installation of dilute phenylephrine into the affected eye. If the pupil dilates after this intervention, it suggests the lesion responsible lies upstream in the sympathetic pathway. Further investigations such as imaging studies, such as MRI or CT scans, can help identify potential structural abnormalities, while additional tests like neurophysiological studies and biochemical analyses may be required to pinpoint the exact location and nature of the lesion. One of the key challenges in diagnosing Horner's syndrome lies in differentiating it from other conditions that may present with similar symptoms. Conditions such as Adie's tonic pupil, oculomotor nerve palsy, or pharmacological side effects can mimic the clinical features of Horner's syndrome, making a thorough differential diagnosis crucial. Understanding the anatomical pathways of the sympathetic nervous system is crucial to comprehend the different levels of lesion responsible for Horner's syndrome. It involves a complex interaction between the hypothalamus, brainstem, spinal cord, and peripheral structures. Disruption at any point along this pathway can result in Horner's syndrome. The management of Horner's syndrome primarily revolves around addressing the underlying cause. In cases of congenital Horner's syndrome associated with neuroblastoma, an interdisciplinary approach involving oncologists, surgeons, and radiation therapists is necessary. For acquired Horner's syndrome, the primary focus is to identify and treat the causative factor. A thorough assessment and, if possible, removal of any underlying tumors or lesions are vital steps in the management process. Assessing the impact of Horner's syndrome on patients' quality of life requires a comprehensive evaluation of both physical and psychological aspects. The patients may experience visual disturbances, difficulties with eye movements, and altered perception of their appearance, which can significantly impact their daily activities and self-esteem. Understanding the underlying origins and risk factors associated with Horner's syndrome is crucial for developing preventive strategies and optimizing patient outcomes. Some known risk factors include trauma to the head and neck region, certain cardiovascular diseases, and specific types of tumors. Exploring these risk factors not only aids in the prevention of Horner's syndrome but also allows early detection and timely intervention in susceptible individuals. Horner's syndrome is a rare condition that affects the nerves in the face and eye. It is caused by damage to the sympathetic nervous system, which controls involuntary functions such as pupil dilation and sweating. Patients with Horner's syndrome may experience drooping of the eyelid, constriction of the pupil, and decreased sweating on one side of the face. It can be caused by various underlying conditions, including tumors, strokes, and spinal cord injuries. A team of specialists, including neurologists, ophthalmologists, otolaryngologists, radiologists, and oncologists work together to diagnose and treat patients with Horner syndrome, ensuring a comprehensive and individualized management plan for the best possible outcomes. It is essential to recognize that Horner syndrome can coexist with other neurological conditions, adding further complexity to the diagnostic process. Conditions such as cluster headache, cervical spinal cord lesions, or carotid artery dissections may present simultaneously with Horner syndrome, necessitating a careful evaluation for accurate diagnosis and appropriate management. Horner syndrome is a rare condition characterized by a triad of symptoms including drooping of the upper eyelid, constriction of the pupil, and a lack of sweating on one side of the face. The primary challenge in managing Horner syndrome lies in determining the underlying cause, which can be vital in guiding appropriate treatment decisions. Diagnostic tests such as MRI scans and physiological testing can aid in identifying the source, but in some cases, the cause remains elusive. This can pose challenges in developing targeted therapeutic approaches. Additionally, certain etiologies, such as tumors, may have limited treatment options available, further complicating management. Another important aspect that deserves attention is the psychological impact on patients and their families, as this condition can have profound effects on self-esteem and quality of life. An understanding of these complexities is crucial for medical professionals to provide comprehensive care for individuals with Horner syndrome. In conclusion, Horner syndrome remains a captivating topic for medical professionals. Understanding the intricate interplay between the sympathetic nervous system and its pathological derangements is crucial for prompt and accurate diagnosis, effective management, and optimal patient care. By developing a comprehensive understanding of Horner syndrome, we can continue to make strides in unraveling its complexities and improving patient outcomes. Thank you for your attention, and I hope this detailed script has expanded your knowledge on Horner syndrome.